Today I am going to talk about pathophysiology of burn. So we'll start with the body compartment. So what happens during the burn? If we revise our body compartments, we have two compartments. One is intracellular space, and then we have an extracellular space. Extracellular space has a blood vessels and interstitial space. So this is blood vessels, interstitial space, and these are the cells. So after the burn process, the blood vessels goes into a shock. So somehow these blood vessels are going to become more permeable to the plasma. So these blood vessels are actually going to have little kind of holes here, so that it kind of start leaking plasma from the blood. So you see little leaking. So what's going to happen after this? The blood is actually going to, sorry, the plasma is going to leak from here. The plasma, not the blood cells. Only the plasma part is going to leak. The reason is because this blood vessels becomes more permeable to the plasma. Then this plasma is going to come out and it's going to stay in this interstitial space. So the first 24 to 36 hour we call it a shock phase, and the shock phase because now person is going into a kind of a dehydration, so we can causes decrease in plasma volume, that's what happens. And because of that, because the volume is decreasing, the molecules here becoming more concentrated, we have a potassium here, and we have a hemoglobin, we have blood cells here, right? We have a RBCs. So now the next step is there will be an increase in potassium, so we call it a hyperkalemia. There will be an increase in hematocrit, there will be an increase in hemoglobin. This is all because of the dehydration. And person's blood, if we check the vitals, the blood pressure is going to drop, right? So there will be a decrease in blood pressure because there is no volume here. The cells are also burning, and we know that cells have a lot of potassium in them as compared to blood. So this potassium will actually start moving here. So that's the another reason the potassium will go high. So very careful checking their potassium. This potassium is really going to go high after burn within 24 to 36 hours. So keep a close eye on that. And then actually the sodium will come out because sodium usually follows the water. So sodium comes out, so person's sodium level is actually going to go down. So that's what happens in this situation. The other important thing happens because of this decreased volume, the kidneys are not going to get volume. They get a decreased blood volume here. Once they get decreased blood volume, they are not going to make urine. So there will be a decreased urine output, which is not good, because if it continues, the kidneys will fail and it will cause a renal failure. So what we are doing in this stage, we need to give more fluid, right? So save the kidneys, save the person. And the other thing can happen during this stage, because of lot of stress, the person stomach will be producing more acid, and we already know there is a decreased blood, there is a decreased blood supply to this area because body has a decreased blood, this decreased blood in their blood vessels. So this is, so the mucosa here is not getting enough blood circulation. Because of that, the mucosa will start breaking, and then there is a increased stress here producing more acid, so people can actually get ulcers. Okay, so this kind of a pathophysiology. And then we have after actually 36, and I need to write here decrease urine output. Then after 36 hours, the body goes into a diuretic phase, which is actually the weight, actually sorry, the plasma is going back to the blood vessels. So in this stage, when it starts going back to the blood vessels, now the danger is the blood volume is going to go high in this stage, and because of that, the person can go into a pulmonary edema. So now we really want to watch for a CVP, central venous pressure. The potassium level can go down, so you are looking into that. The pulmonary edema can happen because person can get a lot of fluid back into the blood vessels. The urine output will increase, right? So increase urine output. So those are the situation, but make sure watch for central venous pressure, because central venous pressure will tell us how much fluid patient is having in his blood vessels, right? So that's what in our diuretic phase. So how much fluid we should give it in a shock phase? This is calculated with a Parkland formula. The Parkland formula is amount of fluid needed in 24 hours is equal to 4 into multiply by patient's weight and multiply with a percentage of burnt surface area. Let's say patient's weight is 60 kilogram, the burnt surface area is 30%. So if I calculate it, so 4 multiplied by 60, weight should be in the kilograms, and then we multiply it with the 30%. Don't write percent here, you just going to multiply it. So this is going to be 24, 7200, right? So it's going to be a 7200 ml of fluid. So this total fluid patient gets it in 24 hours. But now we, according to this, we have to give half fluid in 8 hours, and then we give rest half fluid in rest 16 hours. Okay, so in this case we are going to give three and then 3600 in first 8 hours, and then we are giving 36 ml in next 8 hours. Okay, so that's what we are going to do. So we first 8 hours we have to replace more fluid. We might be thinking, oh my god, how much fluid we are giving to this patient. Yes, but this time, because patient is going into a shock. What does shock means? Shock means your blood pressure is going down, your heart rate is going up, your urine output is going down. That's the common shock symptom. So patient is going into a shock, need fluid, right? That's what we do it. So I'll end my video here. If you have any question, please contact